Good morning, class. I'm Miss Baldwin. I'm going to do the review for your test for this week. We're not doing a Zoom. I'm doing just a video review for you guys, so I can kind of go over the material that you're going to need to focus on for your test. So we're going to start off with your full mouth series. And this is an average of 18 to 20 films, okay? It's called the FMX, and it's going to contain your periapical and your bite wing images. So bite wings are going to show the upper and lower parts of the teeth and the occlusion. So on our guy here, we're going to be doing a bite wing. It's going to get our molars in there. It's going to get in between these molars, and it's going to get the occlusal surfaces of those molars, okay? This is going to be used to detect interproximal decay, early periodontal disease, recurrent decay, and fit for metallic restorations that are going to be done. Your periapical images are going to show the entire occlusal edge, incisal edge, and about 2 to 3 millimeters beyond the apex of the periapical bone. Okay. On the intraoral techniques, we're going to need to know, if you're following along on your notes, all three of those dots there, the American Academy of Oral and Maxillofacial Radiology and the American Association of Dental Schools recommend using the paralleling technique because it provides the most accurate image with the least amount of radiation exposure to the patient. Very important. And it's also used because a patient with a small mouth, a shallow palate, or tori may need to use this bisecting angle technique. Image receptors are positioned parallel to the long axis of the tooth, and this is going to be used to minimize distortion whenever you're doing your x-rays. On your posterior exposures, the exposure sequence of the posterior teeth should begin with the maxillary right premolar. Okay, so your guidelines for placement, the white side of the film is always going to be facing the teeth. So on here, let me take this part off here so that you can see. So when we have this for our periapical, we're going to make sure that the white side that they're going to bite here, this white side of the film, always needs to be facing the teeth. There's a little dot on the film, which you can't see in this film, but you can feel it on the x-ray film here. You always want to make sure that that dot is down in the slot, okay? And these were for your posterior teeth. So these are going to be horizontal this way, where your anteriors are going to be vertical. So they're going to be straight up and down. Still with the white facing the teeth where they're going to bite on it, okay? Incorrect horizontal angulation. What do we know about that and what that results in? It results in overlap and unopened contact areas. Put those up, sorry about that. Incorrect vertical angulation. This results in the images not being the same length as the tooth. They're going to appear too short. It's called foreshortening. Make sure that you know that. And then elongation is going to be where that tooth appears like it's longer than it actually is. Okay? And that's just from whenever it's being positioned in the patient's mouth. They're supposed to be biting on it straight on like this. You don't want them biting like this and you're shooting at it from an angle that way, or vice versa where it's coming down at it, okay? So just practicing those techniques and going over those. I know we haven't been able to do x-rays on actual people, so that's been a little bit more confusing, but just practicing the positioning of it whenever you come in is going to be the most important. Your bite wing technique, this is going to show the crown, interproximal regions of the maxilla and the mandibular arches. It'll also show the crestal bone, and they'll be placed parallel to the crowns of the maxillary and the mandibular teeth. So, again, parallel whenever they're going in. We switched our guys out here. So, whenever they're going in. Oops, sorry. When they're going in to bite. Sorry. I can get this turned around the right way. There we go. So when our guy's going in to bite on this, we're coming in and they're gonna bite straight down. So it should be resting on those teeth, just like that, okay? So we're shooting straight on with it. Little mannequin's falling apart. Exposure for image receptor placement. This is going to show the curvature of the arch is going to differ in the premolar areas. The premolar bite wings are going to include the distal half of the canines. So whenever you're doing it, you're going to be getting, make sure that your placement, that you're getting that distal half of that canine and your premolars, and you may be getting the first part of the actual molar back there, which is okay too. But just making sure that you have all of that in there. The distal part of the canine and the premolars for sure. And then there's a total of 4 bite wings that'll be taken. The occlusal technique is going to be located, used for location of unerupted teeth. And with adults, the size 4 film is going to be used. The size 2 in children can be used. So what do we know about edentulous patients? They're patients without any teeth. So these are going to be, the x-rays are going to be used to detect root tips, impacted teeth, and different lesions within the mouth. And then anything that could be embedded in the bone, okay? When you have a patient that's a gagger, make sure it's going to be easy to get frustrated because you're trying to get these x-rays done because they're important for us to be able to diagnose what's wrong with that patient. Try to have a positive attitude, remain calm, try to keep your patient calm whenever you're doing it, and go in there, use your technique, and try to be as quick and thorough as possible while you're doing it. The digital image technique, different errors that can occur with this. The quality of the image could have been, it's going to do with placement, exposure, and processing time. These are where your errors are going to come with. So improper placing whenever you're putting the x-ray in the mouth. Whenever you went to expose the x-ray, maybe the processor hadn't been warmed up, maybe the chemicals haven't been changed in it as often as they needed to be, or you have exposed that film to light can also be one of the errors that could occur with why your film didn't turn out the way that it was supposed to. Whenever you're mounting dental x-rays, always make sure that you have the patient's name, date, your dentist's name, and the address on there. And then the ADA recognizes labial mounting. Make sure that you know that for your test. Extraoral x-rays are going to be x-rays that are outside of the mouth. Extraoral on the outside. Your panoramic images, these are going to allow the dentist to detect caries, view the entire dentition, and any related structures in one film on it by itself. And I think they probably have some images of the panoramic in the book too. I thought I might have one here, but I'll have to look and see so I can show you. Your equipment, make sure that you know your equipment, know how to use your equipment properly. The main components of our x-ray machine is going to be our tube head, our head positioner, and our exposure controls. So the tube head is going to be the culminator. It's going to be used for pano x-ray machines. It has a lead plate with an opening shaped like a narrow vertical slit, and it's not adjustable, okay? The tube head and the film sensor rotates behind the patient's head, and it has a filament that produces electrons and a target that produces radiographs. Your head positioner is going to be used to align the patient's teeth as accurately as possible. And it's going to consist of a chin rest, and then they're going to have a little notched bite block that they're going to bite into, okay? And they should be standing straight up. You don't want them bent down like this because you don't want to get that cervical spine in there. So making sure that they're positioned correctly is going to be very important whenever you're doing that. Some of the advantages of your pano imaging is that you can view the entire maxilla and the mandibular at the same time. The exposure is quick and easy. Most patients prefer it because it's a lot more comfortable than having RINs or sensors and bite blocks with film in them put into the patient's mouth. And it's also less radiation compared to an FMX because it's one exposure, not 18 to 20 whenever you're doing an FMX. Common errors that are going to occur are going to be ghost images. This is because they haven't taken off their earrings or glasses. If they have anything metal, it's going to show on there, so you'll have to redo that. It's going to be more comfortable, like we said, and lower cost for the equipment. Lead apron artifact, if it's placed incorrectly, the lead apron, especially with the thyroid collar, with it getting up here in the chin, or if they're kind of tilted down like this, that thyroid collar gets up here, it's going to interfere with the x-rays that are being done. And it'll have a radiopaque cone-shaped artifact on the film. And always making sure that you're using your lead apron every time with a thyroid collar to protect our patients, and then protecting ourselves as well, because we don't need to have overexposure either. Positioning errors with the panoramic is going to be the patient's lips must be closed around that bite block. So whenever they're biting into that bite block, it's got a little slit where their front teeth are going to be able to bite into. Just making sure that they close their lips around that whenever they're in position. And then the tongue should be in contact with the palate. So you'll have them put their tongue to the roof of their mouth whenever you're getting ready to do the panoramic x-ray. If the chin is too high, or is tipped upwards, then you will have incorrect positioning whenever you go to do the x-ray. And you'll have a reverse smile line on it. So instead of it looking like it's going like this, it's going to go the opposite way. If the chin's too low, you won't be able to see the condyles on the x-ray. So let me get my little skull here. So our condyles here, you want to make sure that we're getting these in the x-ray whenever they're doing the panoramic. Cervical spine, I had just kind of talked about that. If they're not sitting up straight whenever you're doing it, they have their head tilted down like this, or they're kind of hunched over, you'll get that cervical spine in there, and we don't want that. We want them to be sitting straight up. So we're getting the full image that we're trying to get, so that doc can correctly see everything that's going on. The grid is going to be placed between the patient's head and the film. The device is used to reduce the amount of scattered radiation that reaches the patient during the exposure. It decreases film fog, and it increases contrast on the radiographic image. The scattered radiation is absorbed by the lead strips and does not reach the surface of the film, and this helps to reduce fog. So cone beam, computed tomography. So these are digital images that can be used to manipulate, adjust, and colorized on the computer. They can be sent over the internet. The software allows you to be able to see all the anatomic structures, including the soft tissue. And it's primarily used for the diagnosis of lesions and planning any implant cases that might be coming up. It will also show the location of the mandibular nerve during surgery. And your skull radiographs are going to be used in oral surgeries and orthodontics. Your lateral cephalometric is a common x-ray that is of the bone of the face, skull, and the soft tissue profile. So make sure that you read through your notes, hit on those topics that I just covered today for your test tomorrow. If you do have any questions, you can message myself or Miss Matthews. Just want to say that y'all are doing great and getting closer to being done. So hang in there, guys.